Dear audience, dear guests, dear chair, I would like to introduce my PhD thesis investigating the therapeutic approaches in immune-mediated inflammatory skin disease. I am Máté Krebs, a 6th-year medical student and a 4th-year MD PhD student representing the dermatology, venereology, and the dermato-oncology of Semmelweis University. My vision is to improve the quality of life of people with immune-mediated inflammatory skin disease by assessing and addressing the risk associated with the targeted therapy in immune-mediated inflammatory skin disease. So I have two undergoing projects. The first one is about investigating the infection risk of JAK-STAT inhibitors in the immune-mediated inflammatory disease. And the second one is investigating the risk of inflammatory bowel disease in patients with treated IL-17 inhibitors. We would like to conduct both with the methodology of systematic review and meta-analysis. The first one was launched in September, and the second was started in November. So I would like to talk about the first project. The JAK-STAT signaling is implicated in many immune-mediated inflammatory disease. This pathway has become a major therapy target for IMIDs, such as psoriasis, hidradenitis suppurativa, vitiligo, and so on. The JAK inhibitors works by blocking the parts of the JAK-STAT signaling, offering a significant relief for the patient. And all in all, these inhibitors are highly effective in treating the IMIDs. In the United States, the statistics indicate that approximately 200,000 people are prescribed the JAK inhibitors. But despite the effectiveness, the JAK inhibitors come with serious risks, which the FDA has addressed and specifically highlights the serious infection. As a result, many physicians are concerned about the risk of serious infection, and it created unmet need to reduce the fear around the JAK inhibitors. So it's crucial to understand the infection risk associated with the JAK inhibitors in patients with atopic dermatitis who have elevated baseline risk for skin infection. So our aim to evaluating the risk of JAK-STAT inhibitors in immune-mediated inflammatory skin disease. The primary question driving our research is that, are the JAK-STAT inhibitors associated with increased risk of serious infection in immune-mediated inflammatory skin disease? To structure our research, we use PICO framework, patient with immune-mediated inflammatory skin disease. We would like to compare the JAK-STAT inhibitors to placebo or active comparator, and our outcomes, the presence of infection. Our hypothesis is that patients with immune-mediated inflammatory skin disease have not significant risk of developing the serious infection. The clinical implication is that balancing the disease control and the infection risk is key to provide the safe and effective treatment. To investigate the feasibility of the topic, I collected 3 key articles. These articles investigated the patient with atopic dermatitis. They compared the baricitinib, which is a JAK inhibitor, to placebo, and they investigated the efficacy and the safety. But we would like to include the safety outcomes regarding the infection risk. This is my search key. It consists of three main domains. The first one refers to the intervention. The second one refers to the disease, and the third one refers to RCTs, because we would like to only include RCTs to provide the highest evidence in that topic. At the start of the project, we have around 5,000 articles, and after the duplicate removal, we have 3,200 articles. The topic is feasible. I registered it in the Prospero. I did the duplicate removal, and I am doing the title abstract selection. I hope I can finish today. And I would like to talk about the second project. So the interleukin-17, called for short IL-17, are strong inducers of inflammation contributing tissue destruction in IMIDs, and the IL-17 inhibitors are successfully used for treating various IMIDs such as psoriasis, hidradenitis suppurativa, and so on. It was considered as a potential treatment for IBD but the clinical trials show no efficacy and even worsen the symptoms or cause relapse in the IBD. And the new IBD cases have been reported after the ER17 inhibitor therapy. The studies explored association between the hidradenitis suppurativa and the IBD. The patient with hidradenitis suppurativa have 5.6-fold increased baseline risk for IBD, and there is no consensus on whether it is necessary to screen for IBD before initiating the treatment. So our aim is to evaluating the risk inflammatory bowel disease in patients with immune-mediated inflammatory disease undergoing ER17 inhibitors therapy. The clinical question driving our research is that does the use of ER17 inhibitors increase the risk of developing or exacerbating inflammatory bowel disease? And to structure our research, we use PICO framework. Patient with immune-mediated inflammatory disease, the intervention is ER17 inhibitors. We compare to placebo, and our outcomes, the presence of developing inflammatory bowel disease or inflammatory bowel disease exacerbation. And our hypothesis that patients treated with ER17 inhibitors have a higher incidence of developing or experiencing exacerbation of inflammatory bowel disease. And the clinical implication that improving the patient safety and optimizing the treatment strategies. I did a primary research around 10,000 articles. And I would like to summarize our projects. So we have two undergoing projects, and I would like to submit the first one in September and the second one in January of 2026. And I would like to close my presentation with the words of Estee Lauder: I never dreamed about success, I worked for it. And thank you for your kind attention.
Are you thinking about creating subgroups based on the diseases in your first study?
Yes, it's a fortune that we have a lot of RCTs, and we can create subgroups based on the disease. We would like to investigate the atopic dermatitis, especially who have elevated baseline risk, and we would like to do subgroups based on the different types of JAK-STAT inhibitors, and we would like to do subgroup on the infection, the type of infection, for example, the serious infection, non-serious infection, yeah.
Why have patients with hidradenitis suppurativa have a higher risk for IBD?
It's a complex question. Both diseases belongs to the IMID, the immune-mediated inflammatory disease, and in both disease, the genetic background is quite similar because there are similar genes plays role in the both disease, and similar cytokines plays role in both disease. So yeah, maybe this is the hypothesis for that question.
In the first project, you mentioned in the PICO framework under C that you're going to compare it to placebo and comparators. What are the comparators? And maybe do you plan to do a subgrouping also based on the comparators or based on placebo or comparators?
Yeah, thank you for your question. Yeah, we would like to. The comparator is in for example, the atopic dermatitis, the dupilumab, and the methotrexate. I found these comparators.
I was wondering about the JAK inhibitors. Does the FDA highlight other risks associated with the JAK inhibitors, or regarding to your first project?
Yes, yes. The FDA has addressed 5 main risks: the serious infection, the malignance, the thromboembolism risk, the cardiovascular risk, and they highlight the death. Yeah, so they address these risks.
Which is the most important from them?
It's hard to highlight only one, but maybe the death. I don't.
Thank you.
How would you define serious infection in your article?
So the serious infection resulting in the hospitalization or life-threatening events, or results in congenital deficiency and yeah. So this is the serious infection, which can result in these what I mentioned.
What do you mean by congenital deficiency?
So there is a maybe the JAK inhibitors can go through the placenta and can cause deficit in the baby.
In the first project, you mentioned that you would be interested about serious infections as in JAK inhibitor treatment, but is also any other infection also in the scope? So maybe just mild infections as well?
Thank you for your question. We would like to investigate the serious and the non-serious infection. For example, the urinary infection, the upper tract infection, the nasopharyngitis, and the opportunistic infection, such as the tuberculosis. We would like to investigate the herpes zoster, herpes simplex. So yeah.